Why do we burp? One of the common symptoms that I see in daily practice is burping or excessive belching. Mostly it is the air that is coming out, but some people also experience frequently this sour liquid, bitter liquid that comes up, and also food that is coming back up. Certain foods that can cause excessive burping, issue of excessive burping, and not only that, like bloating, feeling uneasy, abdominal discomfort every time. Let us see in this video why people experience this excessive burping and how we can fix this permanently. How you eat and chew your food is important. Eating large amount of food at once. For example, people sometimes when they go to these buffet restaurants, all they are stuffing up to the neck. Eating in a hurry-burry manner, eating too quickly can make you swallow more air. Portion size of the food needs to be controlled. It has to be smaller. Chewing the food thoroughly is very important, and avoid eating whilst you are standing or whilst you are on the go. Try and make time to eat your food properly. Try and avoid talking excessively whilst you are sat eating, because unknowingly you will swallow more air. Eating in a scheduled time is important to minimize this problem of excessive burping or belching. There are certain drinks that can make you burp more. Lot of soft drinks, if you take especially these fizzy carbonated drinks, which have carbon dioxide as a common ingredient in all of this, and once the carbon dioxide gas gets into the stomach gets full. So this excess of stomach, it will not be able to hold, and it has to come out either in the form of a burp or in the form of a fart. So it's easier for it to come out through the mouth in the form of burping. For alcohol consumers, beer can have the same effect compared to drinking wine or spirits. So if you're noticing excessive burping, maybe if you prefer to have a drink now and again, avoid beer and choose other alternative. Milkshakes, which has this combination of milk, which is a dairy product, and air that is introduced whilst blending, can also cause excessive burping if you're consuming milkshakes on a regular basis. Of course, a lot of these also have a lot of sugar. Drinking milk itself for some people can cause excessive burping because they have lactose intolerance. Lactose is a natural sugar in milk and dairy products. People who have deficiency of this enzyme called lactase cannot digest this natural sugar. So thereby they have this issue of excessive burping. And not only that, like bloating, feeling uneasy, abdominal discomfort every time they consume milk. They may be able to tolerate milk products like paneer, curd, cheese. Certain foods that can cause excessive burping, for example, in Indian cooking, we use regularly onions. Onions contain fructans. These are a type of carbohydrates that can result in excess of gas. Garlic, similar to onions, also contains certain compounds that can increase the gas production, making you to burp and have this bloated feeling. Fried and foods that have got this saturated fats, greasy foods, they take longer to digest and break down in the stomach. So this can also contribute to the gas in the form of bloating and burping. Spicy foods, for example, green chilies, masala-rich foods, black pepper, radish, they can worsen and cause indigestion, gas, and burping. Various sweets can also contribute to the excessive burping due to their ingredients and how they are digested. Cakes, cookies, biscuits, bakery items, they often contain refined sugars, fats, refined flour like maida that can be difficult to digest and can give you more gas. Some people opt for these sugar-free sweets, sugar-free candies. These are targeted especially at people who have diabetes, because they think that these are safer options without sugar. These can give you excess of gas and burping because they contain Certain products, what we call as sorbitol and xylitol, which are sugar alcohols. And these sugar alcohols can give you a lot of bloating and burping. Some people want to avoid sugar in the coffee and tea. A lot of diabetics do that. And they prefer to use artificial sweeteners, thinking it's a very healthy option. Artificial sweeteners can also have the same effect as these sugar alcohols, what I mentioned. People who have this habit of chewing frequently, either chewing gum, pan, gutkas, pan masalas, they swallow more air which gets into the stomach or in the food pipe, and this obviously wants to come out in the form of excessive burping. Same applies to people who smoke, so unknowingly they are also swallowing more air. A lot of people in our country have this bacteria sitting in the stomach lining called H. pylori or Helicobacter pylori. It can cause a lot of problems to the stomach. It can cause damage to the lining of the stomach, irritation in the form of what we call as chronic gastritis. So erosions like having scratch marks in the lining of the stomach, like pre-ulcer changes. It can cause ulcers in the stomach as well as in the first part of small intestine, what we call as duodenum. This bacterial infection can give various symptoms, including excessive belching, heaviness, bloating, nausea, vomiting, abdominal pain. So there are a variety of symptoms that could be linked to this H. pylori. This bacteria is not that tough to eliminate or eradicate. So why does H. pylori give excess of burping? H. pylori bacteria produces urease, which is an enzyme that breaks down urea into ammonia and carbon dioxide. So this can lead to production of excess of gas, contributing for this excessive burping and as well as bloating. Some people have a weakened valve in the lower part of the food pipe that connects the stomach. So because of this, they can get easy reflux, what we call as gastroesophageal reflux disease. So acid reflux can occur very frequently where the liquid from the stomach is entering into the food pipe. This can happen because you might be overweight. In women during pregnancy, this can be a risk. In some people, they have this hiatus hernia where part of the stomach is pushed up, so this valve control is no longer there. So easy reflux of acid or stomach contents can come, and so does the air can easily come up because there is no protective valve mechanism that can hold it intact. The hiatus hernia also causes this reflux and liquid to come up easily, especially when you lie down. Stomach and duodenal ulcers can also have symptoms of excessive burping, fullness, bloating. They may not always have abdominal pain as a common symptom, because a lot of people I hear that how come I have an ulcer, I don't even have any pain. Those who get this excessive burping, they tend to sometimes have it post meal, what we call as postprandial burping. People who have pancreatic disease, where they have chronic pancreatitis or disease in the pancreas, they can also have bloating, excessive burping, feeling full. They can also have heaviness. Some people with pancreatic disease start to lose weight and have loose motions, as well as this excessive burping. Excessive burping can also be seen in a condition called SIBO, or small intestinal bacterial overgrowth, where there is an excess of bacteria in the small intestine where it should not be, because the bacteria is in large quantities, generally in the colon. If it is in the small intestine, it will be, of course, associated with not only just the burping, it can be associated with bloating, passing excess amounts of gas from below in the form of smelly farts. So there are a variety of symptoms with SIBO. People who suffer colds frequently or like chronic sinus issues, sometimes they get this postnasal drip, so there is like constant dripping at the back of the nose. So they swallow, along swallowing the mucus, they will also be unknowingly swallowing more air. So this, of course, can also result in this frequency of belching. Anxiety, stress, nervousness, depression. you can end up swallowing more air without your knowledge, what we call as aerophagia. In some people, it becomes a habit because they feel better when they burp, so they're trying often to force it out. Or it sometimes is also like an attention seeking behavior. Because sometimes I see patients in my clinic, when I keep talking to them and engage them, they stop burping. The moment I stop talking to their relative, they start burping, very loudly. Burping can be due to various factors: diet, lifestyle, mental health. And as I mentioned, there are certain medical conditions that can also be the cause. If your symptoms of excessive burping are present despite the changes in your lifestyle, changes in your diet that I mentioned, you need to seek advice from a medical gastroenterologist.